Hi, good afternoon. So we will now move on to injuries involving what we call the AC joint, which simply means the acromio clavicular joint. So the last we spoke about clavicle fractures, and now we are moving on to the joint related injuries. Now typically joint injuries involving the acromio and the clavicle happens when there is a force directed towards the acromion, and as a result of the fall or the force which has a significant force in this direction, the clavicle is then forced to get dislocated or subluxed, and for this there must be a significant trauma. And often what happens is when the clavicle dislocates, there is significant tearing of these two strong ligaments which keeps the clavicle in place. Now the decision of how to treat such injuries depend on the degree of displacement of the joint injuries. So an X-ray would be done, and sometimes you may even need a MRI scan to delineate the details of the degree of injury involving the particular joint. There may or may not be associated fractures of the very distal end of the clavicle, which then again would influence the decision of whether one requires a surgery. So based on classification, after assessing the X-ray, there can be many different grades, and depending on which grade it belongs to, accordingly an advice would be given as to whether such injuries would be better off treated conservatively or surgically. So if the displacement is significant, and if that individual is relatively active, then surgery may be an option to be considered, because the goal here is to restore the dislocation and to bring the clavicle back to its anatomical position. And to maintain this in that position, you can either use a plate fixation or a soft tissue reconstruction to basically bring the clavicle back and hold it in that particular position. Now this becomes very important, especially in individuals who are using their arms very regularly for high level activities, especially overhead activities, and people who would like to have early range of motion. For those who are treating this conservatively, there will always be a bump or a hump over the distal end of the clavicle, as once it is subluxed, it cannot relocate itself without a surgical intervention. So if you have decided, or the indications are such that you can treat this conservatively, pain will get better, but there will always be a clinical impression of a hump. Now, as I mentioned earlier, if it is within the grades where you can accept a conservative approach, then it will be fair enough to treat it in that manner. However, in terms of functionality, there will be some chronic pain in the long term. Therefore, whenever there is such an injury, and if you find there is an asymmetry between both shoulders and there is immense tenderness between the clavicle and the acromion, get early diagnosis, get an X-ray, and review the treatment options so that you can prevent further deterioration and optimize functionality based on the treatment recommendations. Thank you.